Hey, this is Alex Winter from Bluewave Insurance. You may have heard about a new law that passed back in July called the Big Beautiful Bill. But what does it actually mean for Medicare and for your coverage? Well, that's what we're going to talk about today in this video. So the Big Beautiful Bill is a large tax and spending package that adds a lot of new spending and tax changes without actually fully paying for them. And because of that, something called PAYGO is triggered. PAYGO, P-A-Y-G-O, stands for Pay As You Go. It's a budget rule that says if Congress passes a new law that increases the deficit and spends more than it brings in, then automatic cuts have to be made somewhere else to balance the books. And these cuts have to come from programs like Medicare. So let's start with the biggest change, which is the automatic cuts to Medicare. So if Congress doesn't step in, starting in 2026, there will be across-the-board cuts of about 4% per year to Medicare's budget. Now, over 10 years, that's going to add up to almost $500 billion. Now, this is really important. Your Medicare benefits don't disappear. You're still going to have Part A, Part B, Part D coverage, or your Medicare Advantage plan if that's what you have. What changes is how the government pays doctors and hospitals to treat Medicare patients, and funding for Medicare Advantage, also known as the Part C plans. So that's where you could start feeling the impact. When providers are paid less, they may stop taking Medicare patients, especially those smaller clinics or rural hospitals that operate on tighter budget. That could mean fewer choices of doctors, longer wait times, or driving further for care. And on the other side, if you have a Medicare Advantage plan, you could see your benefits being cut, and those extras like the dental, vision, and hearing benefits could be cut back as well. So the second major change has to do with folks on Medicare and low income. So Medicare had improvements scheduled for the Medicare Savings Program. These are programs that help low-income Medicare beneficiaries for their Part B premiums, deductibles, and copayments. For many people, that extra help would have meant $100 or more back in their pocket each month. Now, unfortunately, the Big Beautiful Bill delays those improvements until October 1st, 2034. That's almost a full decade away. So what does that mean in real life? Folks who are living on Social Security alone, who are supposed to get relief from their Medicare costs, will now have to wait years before that help arrives. Instead of lower out-of-pocket costs soon, they'll keep paying the same higher amounts. For those who are struggling to afford doctor visits or prescriptions today, that delay can make the difference between getting the care they need and skipping it because of the cost. Now let's talk about the third impact. This has to do with Medicare prescription drug prices. When Congress passed the Inflation Reduction Act back in 2022, Medicare was given the power to negotiate drug prices on some of the most expensive medicines. That was supposed to start in 2026. But the new Big Beautiful Bill makes two important changes. First, it expands something called the orphan drug exemption. That means if a drug was approved to treat a rare disease, what's called an orphan condition, it now stays exempt from Medicare negotiations until it gets approved for a more common use. For example, drugs like Darzalex, used for multiple myeloma, or Opdivo, or Yervoy, used in certain cancers, are now shielded from negotiation entirely. In plain English, these companies can keep charging higher prices for longer. Second, the bill resets negotiation timeline for some blockbuster drugs. Take Keytruda, one of the top-selling cancer drugs. It was scheduled for negotiation in 2026. Now that date gets pushed back to 2027. And that one-year delay means billions more in costs for Medicare and potentially higher out-of-pocket costs for folks on Medicare. So the bottom line, while the negotiation program is still alive, the Big Beautiful Bill pokes big holes in it. Some expensive drugs are now off the table completely, and others won't be negotiated until later, which means those savings are delayed. Now, impact number 4 has to do with eligibility changes. So another change in the Big Beautiful Bill has to do with who can get Medicare in the future. Starting in about 18 months after the law takes effect, certain groups of people can no longer qualify for Medicare. This includes individuals with temporary protected status, refugees, and some asylum seekers. Now, I want to be very clear here. If you're already on Medicare or a U.S. citizen or permanent legal resident turning 65, this does not affect your eligibility. Your coverage and right to enroll stays the same. So who does this affect? Mostly new arrivals to the country who used to be able to qualify for Medicare once they met residency and work requirements. Under the new rules, those pathways are closed off. So for most folks watching this, it won't directly change your benefits, but it is something important because it shows how Congress is narrowing who can access Medicare, which could shape the program long term. By the way, I'm going to include sources that I use for my research for this video in the description below, so feel free to check those out. Now, before we wrap up, let's talk about what's not changing under the big beautiful bill. Even though the bill makes cuts and delays, a lot of big improvements to Medicare that were already in place are staying the same. Let's take that $35 monthly cap on insulin. That does not change. And the new yearly cap on out-of-pocket drugs on the Part D plans is unchanged. In 2025, that was $2,000, and in 2026, that's $2,100. Now, it used to be a lot more with the donut hole, so that's a good change. Also, vaccines. Shots like shingles and others are still going to be free, and that's not changing under the big beautiful bill. And of course, the basic structure of Medicare, A, B, and C, and D, isn't being changed by this law at all. So while there are areas where savings are being delayed or reduced, you still have these protections and caps that were added in recent years. So what does this mean for you as a Medicare beneficiary? The biggest thing to know is that your basic Medicare benefits are not going away. You're still going to have Part A for hospital coverage, Part B for doctors, Part D for prescriptions, Part C for Medicare Advantage. That hasn't changed. Where you may start feeling the effect is indirectly. If doctors and hospitals get paid less under Medicare, some may decide not to accept new Medicare patients, especially in rural areas or smaller practices. That could make it harder to find care or mean longer wait times. And if you have a Medicare Advantage plan, you may see a reduction in benefits, especially those extra benefits offered on plans that have like Part B reductions or dental, vision, and hearing coverage. For prescription plans, the savings that were supposed to kick in sooner will now take longer. That means if you rely on high-cost medications like Keytruda or others, you might not see lower out-of-pockets as quickly as expected. And for the low-income Medicare beneficiaries, that extra help that was promised through the Medicare savings programs has been pushed back almost a decade. That's a long wait for people who are struggling now. So the important takeaway is this: none of your coverage is being taken away, but the changes in this law do slow down or reduce some of the financial relief that many people are counting on. Now, if you want to see how this might affect your coverage, or you just want help comparing plans, give us a call at the number below or book a free appointment using the link in the description. And don't forget to click like and subscribe to stay updated on all things Medicare. Thanks for watching the video. We'll see you on the next one. Thank you.